Hey everybody, it is Nurse Eunice with Florida Training Academy, and in tonight's Wednesday Night Live, we're going to be reviewing our CNA Practice Test. And before we begin, congratulations, Angel. Angel says, hello, I just want to say thank you so very much for your channel. I really enjoyed your videos, and I passed my exam with a 97%. I am now certified. Thanks again. You're awesome. You're awesome also, girl. I am so proud of you. So as we do in each of our videos, let's give you about 10 seconds to receive your notifications and we will get started shortly. Hello, everybody in the chat. All right, let's begin, everybody. Hey. All right, so question number 1, team. A CNA enters a patient's room and notices an electrical cord fraying near the bed. What should the CNA do first? A, tape the cord to prevent further damage. B, unplug the device and tag it for maintenance. C, report it to the nurse immediately. Or D, continue with care and report it after your shift. All right, so this is a safety related question. What would be the safest? Hold up, Miss Benita. Oh, you all are just making my heart smile. Oh, congratulations, Miss Benita. All right. So revealing the correct response in 3, 2, and we're torn between A's, B's, and C's. So you all are all over the board on this one. And so the correct response is going to be if you have a cord or a device that is malfunctioning, you're going to unplug the device. Safety. We don't want to start an electrical fire. Look, I'm a nurse. I am not electrician. I'm not maintenance. So you're going to unplug the device and tag it for maintenance. So rationale. Frayed cords are an electrical hazard. So unplugging the device prevents potential harm. Tagging it ensures maintenance is aware. Reporting it to the nurse is essential, but secondary to immediate safety. So that's right. We have like a supply room where we keep broken and dirty items. You'll tag it, you'll put it in there, and then of course after that is when you would allow your nurse to be made aware. And now you all look, this is our third student and we've only been on for like 3 minutes. Hi, Nurse Eunice, I passed my exam on Monday. Congratulations. She's in California, or it's like learners in California. And so I am so proud of you and congratulations. All right, question number 2, team. Which of the following vital sign measurements requires immediate attention from the CNA? Is it a blood pressure of 138/88, a respiratory rate of 22 breaths per minute, a pulse of 34 beats per minute, or a temperature of 99.5? Which one is the most critical? That's right, you got to know your vital signs. So looks like Nathambo, Gerlin, Veronica, Sherry, Marie, Chrissy, you all have the correct response. 34 beats per minute, that's called bradycardia. That's a slower than normal heart rate. That is the one that you want to notify your nurse of right away. So it's C. I know there it says 54, but even 54 is still lower than normal. Remember, the normal heart rate or the normal pulse rate is 60 up to 100 beats per minute. So 34, way too low. All right, question number 3. A patient with Clostridium difficile or C. diff infection requires which type of isolation precaution? Is it going to be airborne, droplet, contact, or reverse? Patient has C. diff. What type of isolation is needed? All right, revealing the correct response in 3, 2, and that's right, everybody who chose C, you got it. It is C. So C. diff is spread through contact with contaminated surfaces. So gown and gloves are required. And of course, hand hygiene with soap and water. Because of the spores, they're encapsulated. Hand sanitizer won't penetrate C. diff spores. So you have to really wash your hands to get the germs off. So great job if you knew that response. All right, question 4. A resident begins choking while eating and cannot speak or cough. What should the CNA do first? A, perform abdominal thrust. B, encourage the resident to cough harder. C, hit the patient in the back. Or D, call for help. And while you all are doing that, look, tomorrow we have our nursing skills lab. So we have nurses from around the world coming in, new nurses, students who have just passed their NCLEX, or maybe some of those who have not passed their NCLEX yet. They're going to be coming in. We have stations, we have our gastric tubes, we have our, our G tubes, we have our NG tubes, we have our catheters, we have IV stations. They get to do ACLS. So once you go beyond CNA, and you need help passing your NCLEX, or let's say you forgot some of your nursing skills because maybe you didn't pass your test on the first time, don't forget about Florida Training Academy. All right, everybody, let's see what the correct response is. Revealing the answer in 3, 2, and yes, it was A. It is A, everybody. So we have a couple of responses. Let's go back. She is choking and cannot cough or speak, but she's still alive. So you're going to perform those abdominal thrusts. And so maybe what threw you off is that we don't really say the term Heimlich maneuver, because the Heimlich family, copyright, they sued. So what you're going to hear us say instead is the abdominal thrust. But you're going to try to get rid of that obstruction by doing the abdominal thrust. If they become limp, that is when you can perform CPR. Hitting someone in the back is a misconception. That doesn't help. That actually pushes the object further down. Your job is to do the abdominal thrust, and then hopefully the object will come out instead. All right, let's go to question number 5, everybody. Question number 5. The nurse told the CNA the patient has a CVA, so allow extra time for them to respond. What does CVA stand for? Is it chronic visual acuity, cardiac valve assessment, cerebrovascular accident, or cervical vertebrae alignment? And Jackie wants to know when we will be live. Jackie, I'm trying my hardest to be consistent and to come on live every Wednesday evening. But we also have a wonderful nurse named Jackie, shares your name, and she comes on Monday nights. So Monday nights and Wednesday nights. And don't forget to turn your notifications on if you're on YouTube. That way you will get a notification whenever we do go live. I usually post that information a day before the online training. All right, everybody, let's reveal the correct response. And so if you chose C, you got it. That's right. A CVA is a stroke, but it's also, the medical term is cerebrovascular accident. It is caused by interrupted blood flow to the brain. Patients may have impaired speech, mobility, or cognition. Jackie, we won't be going live for the nurses. No, that's all hands on. There's so much to learn. We can't go live. We'd never get our class done. But whenever you're ready to come to Jacksonville, Florida, we can definitely have you here and you can learn your skills in person. All right, question number 6. Make sure you apply gloves before emptying a resident's suprapubic catheter bag. The charge nurse reminds you, where is a suprapubic catheter inserted? Is it through the urethra, in the rectum, directly into the bladder, through the abdomen, or into the kidney? Ooh, where is a suprapubic catheter inserted? We'll give you about 5 seconds for that one. All right, revealing the correct response in 5, 4, 3, 2, and so many correct answers. I am proud of you. Yes. If you said C, directly into the bladder through the abdomen. So supra means above. And of course, we know what the pubic area is. So a suprapubic catheter, it bypasses the urethra and is inserted directly, into the abdominal wall. Excuse me. All right, next question. All right, so I'm still getting over a cold, so I apologize. Question number 7. A CNA finds a resident on the floor. The resident says they are fine and tries to get up. What should the CNA do? A, assist them to stand immediately. B, leave them in place and call for the nurse. C, check for injuries and then assist them to bed. Or D, ignore the request and leave the room. For this one, we're torn between B's and C's. It's like half and half. It's like even. All right, so I give you about 5 more seconds. In 3, 2, and that's right. Leave them in place. Do not try to get them up because falls may cause internal injuries that may not be immediately visible. So the nurse has to assess the patient, and the nurse will direct you and the rest of the team members to help get the patient up. But the nurse needs to come in first. All right, question 8. A CNA observes a new skin tear on a resident's arm. The nurse is extremely busy. What is the first action the CNA should take? A, ignore it if the resident isn't in pain. B, apply a bandage and continue care. C, document the injury in the chart. Or D, report the skin tear to the nurse as soon as possible. What do? Your nurse is busy. Patient has a skin tear. What do? We have so many D's. Let's see. Do we have any other answers? In 3, 2, and you're right. Don't put a band-aid on that. A skin tear is, if the skin is so thin, you put a band-aid on it. When we take the band-aid off, it's going to tear off that flap of skin. So the best thing to do is to leave it be and then notify that nurse. So D is the correct response. Here's the rationale. Skin integrity issues must be reported as soon as the nurse is available. So the nurse will assess and decide on the treatment. And normally the treatment is never a Band-Aid. All right, let's go to question number 18. Question number 9. All right, so if you've stayed this far and you haven't already subscribed to our channel, go ahead and do so. And if you haven't liked the video, go ahead, help a nurse out. And if you haven't shared it with your family members or friends or your cohort, your CNA students, go ahead and share it. Question number 9. Which of the following is not a sign of hypoglycemia? Is it sweating, trembling, confusion, or slow, deep breathing? Which is not a sign of hypoglycemia? I love it. You all are torn between C's and D's and more C's and more D's. Now we have a B. All right. So as you all know, hypo, that prefix means low. Glycemia refers to the level of the sugars within the bloodstream. So when someone has a low blood sugar, they will sweat. That's called being diaphoretic. Because their sugars are low, they can start shaking. And because the brain needs sugar, they can also be confused. So the correct response is D. That's right. Usually slow, deep breathing is not associated with hypoglycemia. It's instead associated with hyperglycemia or diabetic ketoacidosis. So the opposite way. Let's go to question number 10. A patient was incontinent of urine overnight. What does this imply? Let's see if you know these medical terms. A, they vomited during the night. B, they are unable to urinate and need a catheter. C, they were unable to control their bladder. Or D, they fail while trying to use the bathroom. Understanding those key terms. What does incontinent mean as it relates to urine? And 90% of you answered it correctly. So Incontinent means that they can't control it. So it is C. They were unable to control their bladder. It does not mean that they are retaining urine. Instead, they're letting it out. And so they're going to be wet. So incontinence refers to the loss of voluntary control over urination or defecation. So someone can have fecal incontinence. They can also have urinary incontinence. And for your test, don't forget, a CNA never inserts a catheter. So if your patient is incontinent, the way that you're going to manage that is by taking them to the bathroom more frequently. Question number 11. The MAR, which is the medication assistance record. And so sometimes we're just going to say it's your physician's order, because this wouldn't necessarily be on the MAR. But the MAR states that the patient should receive OOB. Is it A, out of bed to chair once daily, B, out of bed to chair twice daily, C, out of bed to chair before insulin, or D, only on bed rest today? What does OOB to chair BID mean? Let's see if you remember your medical abbreviations. And so many of you answered it correctly. Yes, it is B. Great job. So OOB equals out of bed, and BID, as far as frequency, equals twice daily. And so it's a mobility goal to help prevent complications like pressure sores and contractures. Do not let your patients stay in bed all day. If they are actually bedridden, you can get them out of bed using a Hoyer lift. So patients who are in bed all the time, they usually have worse outcomes and they are less likely to be rehabbed. So get them. Question number 12, team. A resident has an order for a fluid restriction. Which of the following beverages should the CNA offer? Would it be A, the allowed amount of prescribed fluids, B, coffee with extra cream, C, small amounts of water every 2 hours, or D, sports drinks to maintain hydration? Ooh, this one's tricky. Ooh. All right, I'm giving you about 5 more seconds because I only saw 2 correct responses so far. I see more correct responses. Yes, team, you have it. Yes. So whenever we say a patient has a fluid restriction, that's usually written by a doctor, and they tell you the exact amount of fluid they can have within 24 hours. And so it is going to be A, the allowed amount of prescribed fluid. So fluid restriction orders must be strictly followed to prevent fluid overload, especially in cardiac or renal patients. And so what some of you will do is whenever it's time for bed, you will take the patient's fluids away as if they're your kid, like you're potty training your child. You cannot do that. Your patients cannot be on a fluid restriction just because you don't want them getting up in the middle of the night because they drink fluids. That's actually called neglect. So it has to be ordered by a doctor, and we usually don't do it because of incontinence or using the bathroom. It has to be a medical reason for a fluid restriction. Question 13. You observe in the care plan HX of CHF, monitor for edema. What should you watch for? Is it coughing and sneezing, swelling in the legs or ankles, skin rashes, or bruises on the back? HX of CHF. Look, I'm going through these medical abbreviations with you now. You won't have a lot of abbreviations on your test, but as soon as you pass your test and you're a CNA and you go and apply at a job, this is how we speak. This is what you're going to see in the chart. So you might as well learn this stuff now. All right, give me a few more seconds. In 3, 2, and yes, everybody, it is B. Ooh, look at those legs. Oh my. So CHF means congestive heart failure. The heart is failing, so the heart is not pumping properly. So the fluids are going to accumulate, usually in the legs and the ankles. Edema refers to swelling. And so as a CNA, you're giving your patient a bath. You see the legs, they look like this. You're not going to leave the room right now. The patient's not in distress, but what do you do to those legs before you leave the room? Okay, you're going to come and tell me. I probably already know, but I'm not in the room with you right now. So if you see that somebody has swelling in their legs, if they have edema, what is an intervention that a CNA could do? Put it in the chat. Let's see if you remember. That is right, everybody. And Thea, Tony, they said elevate those legs. That is correct. Put those legs up in the air, maybe put a pillow or two beneath them, and that's going to kind of reposition that fluid. Question 14. The residence chart notes history of DVT. While repositioning the patient, what should you avoid? Is it massaging their calf, encouraging fluid intake, elevating the legs, assisting with deep breathing exercises? What do you want to avoid when a patient has a history of blood clots in their legs? Ooh, let's see if you remember. All right, team, we're revealing the correct response in 5, 4, 3, 2, and 100% of you all got it right. I see so many correct responses. It is A. If somebody has blood clot, don't be massaging their legs, because if you do, you can make the clot dislodge. And when it travels, it can travel to the lungs. They can have a pulmonary embolism. If it travels to the heart, they can have a heart attack. If it travels to the brain, they can have a stroke. So DVT stands for deep vein thrombosis. And as I just stated, that massaging that leg is something that we do not do, because it can cause that blood clot to travel. Question 15. A patient with Parkinson's disease needs assistance with eating. The patient is on a soft diet. The CNA should A, feed them quickly to prevent spills, B, provide thickened liquids, C, provide adaptive utensils, or D, allow them to eat unsupervised. This one's tricky, so really read it. I see half and half. I see a couple of correct responses, but pretty much you've chose every answer except for D. So let's read it again. A patient with Parkinson's disease needs assistance with eating. They're on a soft diet, not a pureed or a liquid diet. What should the CNA do? Because they tremble when they eat. So what should you do? That's right. If you chose C, that is right. They didn't say anything about them aspirating. They just need adaptive utensils. So it's going to be C. Patients with Parkinson's disease often experience tremors and muscle stiffness that can make eating difficult. Adaptive utensils such as weighted or built up handles help promote independence and dignity during meals by making it easier for them to grip. All right, question 16. A CNA is assigned to care for a resident with a colostomy. Which of the following is the appropriate action? A, change the colostomy appliance daily. B, monitor the color and consistency of the output. C, irrigate the colostomy to prevent blockage. Or D, insert a catheter into the stoma. And so many of you all pass your CNA test. So this is my recommendation. If you are understanding the terminology better when it's read to you, in almost every state, they have an audio test for the written test where you can get an audio headphone and the computer will actually read the questions and the answers to you. So don't be afraid to utilize it. So with that being said, is the answer to 16 A, B, C, or D? And we're torn. All right. I see a lot of correct responses, so we're going to go ahead and reveal it in 3, 2, and 1. That is right. The answer is B. So that colostomy wafer or appliance is not changed daily. It's changed as needed. And usually you won't be responsible for that if your nurse hasn't signed you off on changing appliances. But what you would be responsible for is monitoring the color and consistency of the output and also emptying the colostomy appliance. So CNAs can observe and report findings, but cannot perform invasive procedures like irrigation. And if you've been trained and your facility allows you to do so, you will be able to change that appliance if it becomes loose or at the frequency prescribed by the physician. Question 17. During morning rounds, you notice that a resident appears extremely thin with visible bones and little muscle. The nurse mentions that the resident has been battling cancer for months. What term best describes their appearance? Is it A, dehydrated with flushed cheeks, B, emaciated and weak appearance, C, muscular with high energy, or D, swollen hands and feet? They are thin with visible bone and little muscle. We call that atrophy. Okay, so they're not eating a whole bunch. What would be the correct response? And everybody has it. I'm so proud of you. Go team. That patient is emaciated. Okay, so emaciated means extremely thin or undernourished, often due to chronic illness like cancer or AIDS. It is a sign of severe weight loss and muscle wasting. So this patient, they won't have an appetite. So pretty much every time you go into the room, if there's a supplement in there, you want to be offering them that supplement. Give them the supplements usually have protein and it has, carbohydrates. So if they're not eating the food, please let the nurse know because I can then go in, talk to the patient, figure out what they want, and then call the doctor. And if we can't, get a happy medium, we're going to be pushing those boosts. We're going to be pushing those Ensure, those supplements, which can provide them with the extra nutrients they need. Question 18. While assisting a resident who fell in the hallway, you notice a shallow scrape on the forearm. The skin is red but not deeply cut. What type of skin injury is this? Would it be a laceration, a puncture wound, an abrasion, or a bruise? This one's a little tricky. The skin is red but not deeply cut. They have an injury. You have to learn your medical terminology. We have a lot of C's and D's, and we have an A. All right, so looks like we're teaching you some new terminology today, revealing the correct response in 3, 2, and it's C. It's just an abrasion, you all. It's just a scrape. So an abrasion is a surface level scrape of the skin. A laceration is a deeper cut with torn or jagged edges. And, it's not that you're going to be documenting this in the medical, your chart, but you at least want to say the correct terminology. So a laceration is deeper. A scrape is just an abrasion. So whenever you are, describing your conditions to a patient, hey, they have an abrasion versus a laceration. You tell me someone has a laceration, I think of a gash. I'm coming in a lot faster than if you say a patient has a scrape or an abrasion. All right, question number 19. The CNA is feeding a resident who begins coughing violently. What should the CNA do first? A, stop feeding and encourage coughing. B, hit them in the back. C, give the resident water to wash down the food. Or D, pat the resident on the back forcefully. What do? They begin coughing violently. Everybody got A. That is right. It is A. If they're coughing, encourage them to cough. They are not choking. They have a partial obstruction. So yes, you're going to stop the feeding. And then you're going to encourage them to cough. Coughing may indicate choking. The CNA should stop feeding immediately and encourage the resident to clear their own airway. And now at the point in which the patient stops coughing, that is when you would perform the abdominal thrust. Question 20. Oh my, we're almost done. Man, this goes so fast. Question 20, team. You're preparing to take a manual blood pressure reading. Where should you place the stethoscope to hear the brachial pulse? A, directly on top of the spongy vein in the antecubital area. B, on the inside of the arm at the bend of the elbow. C, anywhere on the upper arm. D, it doesn't matter. You can't hear it anyway. You didn't know. You don't even know why the facility makes you do manual blood pressures. You want automated blood pressures. But I need for you to understand what the brachial pulse is. And so is it A, B, C, or D? And the nurse goes, wow, because Veronica and Mackenzie and Jackie and Shada, so many of you all knew that the brachial artery is not a vein. That is on the inside of the arm at the bend of the elbow. So the brachial artery, again, is not that spongy vein that you see when you look at someone's arm, but the brachial artery is where you place your stethoscope. It is where you listen for the blood pressure sounds during the manual reading. Arteries carry oxygen-rich blood away from the heart and have a strong pulse. Veins, however, carry blood back to the heart and do not pulse in the same way. So the brachial artery is located at the bend of the elbow. We call it the antecubital space, slightly toward the inner part of your arm. That's the best place to, best location to place the stethoscope for an accurate blood pressure reading. Question 21. What is the correct procedure when recording a resident's intake and output? A, measure intake in ounces and output in milliliters. B, only record fluids given during meals. C, record approximate amounts at the end of the shift. Or D, document all fluids consumed and excreted in milliliters. And so every facility may be different, but based off of these options, that is right, everybody. You have it. It's going to be D. Some places may have you document in cubic centimeters or cc's. For the state of Florida examination, however, whenever you're emptying a urinary drainage bag, you have to document in cc's. So it, again, depends on the state, depends on the test, but either way, you're going to document all fluids that are consumed and or excreted. And so if the patient has diarrhea, you would actually measure that too. So, and if they vomit, we measure that also. So accurate INO measurements require recording in milliliters for consistency and precision. And remember, 1 ml is equivalent to 1 cc. So some places use that universally. Question 22. In the evening, a resident with dementia becomes confused, restless, and tries to get out of bed repeatedly. Early in the day, they were calm. What is this behavior called? Is it delirium, hallucination, sundowning, or mania? That is right, Chrissia, Tanaka, and Jennifer, and Anthea, and Emilia, Naomi, Markenzie, Janice. Yes, you all have it. It is sundowning. So it is C. Sundowning is increased confusion and agitation that occurs in the late afternoon or evening in residents with dementia or Alzheimer's. CNA should create a calming environment and maintain routine. And something else I want to say about patients who have sundowners or who sundown, period, is that during the day, they may remember where they had you place their watch. During the day, they may remember that they didn't want a bath. Make sure that you document this, because when they get confused in the evening, they're going to say you stole their watch, or they're going to say that you never offered them a bath before, that you didn't go into their room. So if you take anything off of a patient, make sure you document it and let your nurse know. And then also if you don't give a bath, you document it and you also let your nurse know, so that you won't get in trouble later when the patient does have late night confusion or when they sundown. Question 23. A CNA overhears two coworkers talking about a resident who had gestational diabetes. What makes gestational diabetes different from type 1 diabetes? A, it requires insulin and occurs in teenagers. B, it only happens during pregnancy. C, is a permanent condition caused by poor diet. Or D, is more dangerous than all other types of diabetes. So you're going to hear us say diabetes a lot, but there are different types of diabetes. What differentiates gestational diabetes from type 1 diabetes? And we're torn between B's and C's. We're like even, like 50-50. All right, the bees have it. The bees know that gestational diabetes only happens during pregnancy. So, again, gestational diabetes develops during pregnancy and usually goes away after delivery. Meanwhile, type 1 diabetes is a lifelong condition where the body does not produce insulin. So, usually, type 1 diabetes is juvenile diabetes. Type 2 would be the adult onset diabetes, and that's usually when they can take pills, or if the pills don't work, the oral anti-diabetic agents don't work, that's when they will progress to insulin. Question 24. You enter a resident's room and find them lying still. They don't respond to your voice, but are breathing slowly and they have a pulse. What condition does this describe? Is it cardiac arrest, sleepwalking, unconsciousness, or a seizure? Oh, this one's tricky. I love it. I can like sense the tension. I see A's and B's and C's. I'm waiting for 5 more responses, then I'll reveal the answer. All right. Three, two, one more person. Paulette says C. And guess what? Paulette and Awa and Mona, you are right. Bridget, it is C. So they're still breathing, you all, and they still have a pulse. Hallelujah. It is C. They are unconscious. So, an unconscious person is unresponsive, but still breathing and they have a pulse. Cardiac arrest means no pulse and no breathing. It requires immediate CPR. What are some reasons that your patient can be unconscious? Put them in the chat. So when you do that, hey, are you okay? You tap and you shout, your patient's still breathing, but they're not responding to you. What would be a reason that a patient would be unconscious? We know you're going to press that code button. If you're in home care, we know you're going to call 911 from your phone. We know you're going to scream for help, but why would a person be unconscious? Let's see if you can give me some responses. All right, let's see. I just mentioned one. We just talked about it. Myla, I see you, girl. Myla says they could have overdosed on medication. They could have syncope. These are just a few of many reasons. Absolutely. So their blood sugar could be low. And so Bridget says they could have just gotten out of surgery. So anesthesia also, you also, great job, team. I am so proud of you. Tanaka says they could have fainted. Remember, all of those are still medical emergencies. The difference is you don't have to perform CPR. Okay, so that's a huge difference. And our goal would be to get that nurse in the room so that they get better and not get worse. Question 25. You're instructed to collect a stool specimen from a resident for testing. Which is the most important for proper collection? So you have to collect the stool specimen. Would it be A, collect the stool from the toilet after the resident flushes? B, place toilet paper in the bedpan before the resident uses it? C, scoop the stool directly into the specimen cup using your gloved hands? Or D, use a clean bedpan or hat to avoid mixing stool with urine? So, yep, you're going to have to collect some stool also. What do? How do you collect it? All right. Whew, I'm so glad no one chose C. Everybody chose D, so you are right. And so, when collecting a stool specimen, it's important to use a clean, dry collection device. Sometimes, like a specimen hat, that's what you'll put towards the back of the toilet, or you can have them go in the bedpan. That way, and urine should not mix with the stool as it can contaminate the sample and affect test results. Always wear gloves and use a proper tool. Like usually we'll use a wooden tongue blade in order to transfer the stool from the bedpan or the specimen hat into the collection cup. Don't forget to label and also date your once you label your container, don't forget to sign it, initial it, and date it. And do not collect stool from the toilet or after flushing. And of course, never use your bare or gloved hands. Use that wooden tongue blade instead. And as we say in each of our videos, you all, care CNAs become caring nurses. And so I know that you all are going to be phenomenal. We hear so much negative stuff about the medical field. I hope that you and I will be those bright lights because the world needs us. We have baby boomers, we have job security. So you get out there, you do a good job, you do the best that you can. And who knows, one day I may see you online teaching classes just like me. So, everybody, thank you for watching. Sorry, I still have this cold, but hopefully it'll go away soon. I love you. God bless you. And I will be on next week, next Wednesday, but Jackie will be on Monday. And so don't forget to comment, like, share, and subscribe. Bye, friends. See you in the next video.